Insurance fails in the developing world. Let's do a root cause analysis. Healthcare insurance. Let's do a research. We'll do overview. We'll see some publications. We'll see some findings and what are the roadmaps. So it's a case study examining why Nepal's national health insurance program fails to reach its citizen and the evidence-based path to reform. So before I begin with my research for a long time, since 2018, uh, what I see is that the technology is there, the developers are there, but they are not interconnected. The main, very basic problem resides in data transfer. That is because of the leadership problem. The leadership changes all the time. Another problem, what I see, is vendor capture. Because there are plenty of vendors and they do not work interconnected. And third thing is there is a syndicate. It's about the money. So there is a huge gap in the software. So none of the software used are basically certified by any organization in the country. It's not only the problem of Nepal, but this is a case study of Nepal, but I'm talking about the failure and the path to success in healthcare insurance in the developing world. Now let's overview. This is verified program data. The scale of the problem is like under 20% of the population is actively covered by. So this is a report. 35% enrolled household did not renew. 58% spending is out of the pocket. Most recent WHO data. Fewer than five to be noted. Clinician informatics with 12 clinical and informatics training nationwide. So what we need is a doctor who is trained in clinical informatics, taking a leadership role or an advisory role. So, he is the one who knows where the problem is. So now, let's see the findings. There are 4 interlocking failures domain. So the key findings are like there is no unique patient identifier. So Nepal has no unique health ID. So interoperable claim system. So claim system is not there. There's high rejection rates are driven by administrative coding errors. Coding in other parts of the world, the ICD-11 and the coding, basically it's a job. It's a 4, 5, 6 months of training, harsh training. But what happens in the developing world is they just say ICD-10, 11, and there is no EMR, and there is no interoperability. So these are the very basic steps, and these are all because of the leadership problem. So let's go to the third part, like the critical workforce deficit. Fewer than 10, I quote and unquote, 10 professionals with formal clinical informatics training exist in Nepal. So we need those. And the hospital, they do not have clinical informatics department. Engineers in health IT cannot substitute the physician's role as in clinical informaticist. So this has to be taken, noted. And the other thing is government's fragmentation. The federal devolution in 2017 created ambiguous accountability across 3 government tiers. None, I say none, adequately resourced for insurance operations. Multiple government transitions between 2016 and 2023 disrupted the national institution. So now, the reform pathway. It's a sequenced agenda for the change, what can happen. With plenty of research, what I found 4 phases. Phase 1 can be a foundation, nation ID rollout, claim system integration, government reform, health data governance law. And then in phase two, by 27, we can do enrollment expansion like biometric enrollment, mobile premium collections, sliding scales, informal sector outreach. In the phase three, we can look at quality and outcomes, the how provider performance metrics, clinical informatics training. So this is the most important part, doctors and engineer working together. It's not IT. They say IT, okay, give this to IT, and the leadership is not taking role in this. And another thing, the most important is fraud detection system. After everything is okay, then by 2030, we can have sustainability program, full, community level, full health management information system, clinical informatics degrees, regional knowledge sharing. So basically, uh, you know, so that is the roadmap. What I think now, let's see. Um, I mean, what's going on? What my research find out, and let's see some, you know, research what I did about. Let's see about the PDF in white paper about this. So now that I found out that it is a public resource and with executive summary and introduction and all these things. So basically, the barriers are documentation requirement, annual premium, distance to enrollment, regulation, estimated impact, and the sources are from Ministry of Health and Population, HIV data, the information system deficit, and international lessons like Rwanda's community-based insurance scheme and the reform agendas. So there's a lot going on. So we have to do plenty of jobs, and the references are from like Central Bureau of Statistics, yeah, and some from our own part of the world, from Ministry of Health and Populations, blah blah blah. So there's a lot we can do research on, and and another paper we can check is like the journal article which I wrote for American Medical Informatics Association. Basically, it's an original research article, and it's about informatics infrastructure failures in the national health insurance. It's a mixed method research study with evidence from a developing country. So, what the result was like the four interlocking failure domains were identified: the absence of national unique health identifier, non-interoperable claim management system with high admin rejection rates, and the conclusion was like sustainable health insurance in low research setting requires a sequenced informatics reform agenda prioritizing national unique identifiers, interoperable infrastructures, and clinical informatics workforce development. So these things can be achieved, but with only good leadership. Technology is already there, engineers are there. Only problem is leadership. We need a great leader. So going through the research article and the assessment, the workforce deficit, geographic disparities, governance deficits, a lot to think about. This is easy, but at the same time not easy. When like a lot of international agencies come and they say we'll donate, we'll work for you, and they just do half a work, and they just leave, and our system does not work. So with 14 different references, I came to this conclusion about healthcare insurance in a research. I did an overview, did some publications, found out some findings, and did some roadmap. So, thank you very much.